YouTube. Okay, YouTube, it is time for us to pack. I've already packed, but I actually kind of have to repack because I got some more things. So I figured this would be a good time for us to go over what I've gotten so far. Honestly, it's not so far. This is it. I have no more space for literally anything else to take with me on this mission trip. We're gonna try to go through it as quickly as I can. This might give you guys some ideas or inspiration for anyone else who's going on mission trips, things that you can bring, things that you can donate to mission trips if you're not comfortable donating actual physical cash, because I know in recent years that has become a concern when it comes to mission trips. So these are just some things I am bringing with me as a doctor to donate, to use, stuff like that. First of all, pregnancy tests. This is for the patients. We will be offering gynecology services or women's health services. So I got these on Amazon. They seem to be a reputable pregnancy test. We use a similar one in my office. But yeah, these pregnancy tests should be pretty easy to use, and it comes with the collection like pee cup that patients can give their urine sample in. Condoms, I talked about these before. Condoms are super important. Sexual health and infectious diseases are really on the rise, not just in the US but across the world. So it helps if we can afford patients the ability to have safe encounters with their partners and avoid transmitting diseases, contracting diseases, that kind of thing. Condoms tend to be expensive in other countries, so this is one way that you can just help to prevent transmission of infectious diseases. Pads, tampons, whatever. I prefer to give pads because at least depending on where you're going, the culture there in terms of how women interact with their menstruation or their period can be a little bit limiting in terms of the mindset. Some women don't prefer the use of tampons or insertive devices like Diva cups or things like that. So pads tend to be pretty safe. You can throw in a couple tampons because there's maybe some people who prefer that. You can do Diva cups because period poverty is a big thing in a lot of these countries that we do mission trips in. Period poverty across the world actually, but a lot of these countries tend to suffer from period poverty, and having Diva cups would be a safe and effective way for patients to be able to supply their every need without having to worry so much about having to repurchase, because the condoms and pads that we give, they're like single use, so you use that and you throw it out. It's not a Diva cup or period underwear. Those things might be more easily like reusable, but you might encounter needing to do some patient education, and it's a good opportunity to do patient education and help patients understand what their options are when they're trying to spread their dollar, especially for women and girls who experience menstruation. This is a Snellen eye chart. We use this in my office on a regular basis to help test patients' eyes. So last time when I was on the mission, we ended up using one that we had on our phones, which wasn't the most accurate, and it was a little hard to see because it was very small. And obviously we had to adjust the distance, but yeah, I brought one of these. A good thing to always bring with you is a blood pressure cuff. Honestly, I recommend these blood pressure cuffs to my patients all the time. They are on Amazon. They're pretty cheap. They're battery operated, which you tend to need because sometimes when you go on these mission trips, you don't always have access to a plug. And it sucks because these are AAA batteries and I thought they were AA. So the batteries that I bought won't work if this dies, but that's okay. I'm not gonna stress out about it. But yeah, so we have a blood pressure cuff. It's always great to bring, and then I also bring my own personal pulse oximeter. This is the device that we put on patients' fingers to test their pulse oximeter is the device that we put on patients' fingers to test their heart rate and their oxygen saturation. I don't know why I'm struggling to say that. It's pretty late, I'm tired. All right, so I need to go buy a bunch of AAA batteries. But yeah, so pulse oximeter is always a good option. Again, I got these on Amazon years back. They've been great. I think they're awesome. I have 2 of these. I have 2 blood pressure cuffs. Pretty simple. And I'll probably just leave these with my grandmother afterwards, so she has a device of her own to use. I got these disposable ear tips for the ear irrigator that I bought to help clean out patients' ears if they have like cerumen impaction. This device here, so these are the tips that go on here to replace it. I think this comes with a pack of like 60 pack. So I got this on Amazon. Masks are always a great option. These are pediatric masks because people always remember to bring the adult mask but never the pediatric masks. Transparent dressing or Tegaderm. I got them in different sizes as well because very often we have, you know, foot wounds or things that need to be wrapped, and it helps if I can cut them and, you know, turn them around or put them in different shapes and sizes that can help with the wounds. Sometimes we have irregular wounds that we need to be able to dress, so it helps if I have them in different sizes. And then I have a whole bag of just like wound dressing, ointment, those kinds of materials. So this is like bacitracin ointment. I've got some Benadryl ointment. I do have some liquid bandage, which like you just paint on. It sucks because it's not the most sterile because of the paint, so I will actually end up using Q-tips to get it on as opposed to using the, you know, that liquid over somebody else's blood and then use it on somebody else. Like, no, we won't be doing that over here. And then I got like regular band-aids of different sizes. This is cloth scissors to cut if you know something happens. I got some hydrocortisone cream. And then I also have some paper bags to give patients and some gauze like Ace Wrap, povidone iodine to clean wounds if needed. And this is like a lidocaine cleaning spray. So this whole bag, literally, like if there is some kind of first aid, I'm gonna grab this. But I also have a first aid kit which has a bunch of other stuff. This is the stuff that comes in the first aid kit. I got this first aid kit at Target. It's very easy and affordable. It says it has 85 first aid supplies. So in it has 24 sheer bandages, 6 alcohol prep pads, 5 fabric bandages, 2 paper tapes, 1 plastic carrying case, which is the outside, 24 sheer bandages, 4 sterile pads, 2 triple antibiotic ointments, 1 instant cold pack, 10 butterfly closures, 4 hand cleansing wipes, vinyl gloves, and then 2 non-stick pads. So that's pretty comprehensive and a very nice compact size. I also bought one of these for my house for my personal use, just in case something happens. Also got alcohol wipes, pretty, you know, self-explanatory. These are similar to the ones that we use at the clinic. We use these to wipe down patient beds, wipe down materials or things that we reuse. I got some Sharpie markers. This is a pack of 12, just because we'll be writing our names on stuff. We'll need to label things that are handwritten, and it just helps if we have Sharpie markers that I don't have to be searching for. What else? Salon Paws or lidocaine patches. So I got a bunch of those. I mean, back pain was a major complaint on the medical side of the mission when we're seeing patients and doing like an actual patient care visit. So back pain, a major thing is like, I can't do much for them. I can refer them to physical therapy or say follow up with your PCP, but it helps if I can give them a little bit of relief with some patches. So I bought a ton of those, and I also bought the capsaicin cream. These are the isolation gowns. I bought these to help with covering us up because sometimes we're doing wounds. Sometimes we end up having to jump out and, you know, help patients in a car accident or some kind of emergent situation that involves blood and body fluid, and we're in our like regular clothing or scrubs and things that we have to, you know, keep working in for the rest of the day. So it just helps to have protective gowns. I bought a whole bunch of these like toothbrushes. They were $1 at Walmart. These are not the most ideal toothbrushes, but they're better than nothing. Lots of people can't afford to buy toothbrushes, so I change them as often as they need to. So it helps if you have a free one that someone gave you, just like you would if you went to your regular dentist's office. Okay, gauze pads. I got these. These are the 4x4 gauze pads. Pretty simple, quick and easy. Or these are the 2x2 gauze pads, not the 4x4s. I thought we had the 4x4s, but that's fine. And then I also bought the larger size. These are the 4x4s. Yeah, because I know I bought 4x4s. So these are the 4x4s, and then these are some 2x2s. All right, diabetes testing supplies. I got a brand new glucometer. I always bring a brand new glucometer because I usually end up donating the one that I bought and brought. So this is the Relion brand. I honestly prefer buying the Relion brand. It's either this or One Touch. Those are the two brands that I usually stick to. Can I say that one is really better than the other or better than any of the other ones? No. The reason I prefer them, at least from my anecdotal experience or anecdotal observation, whenever I go into the stores, these are the ones that are most readily available to me. Now, can I say that that's good or bad? Because are they readily available because no one wants them, or are they readily available because the supplier is better? Who knows? I can't say. All I know is I don't want to be buying things that I have to like have a hard time being able to get or source. So I like the Relion brand, and they have a bunch of different like Lancets, AccuCheck strip, not Lancets, test strips and stuff like that, which I bought. And then alcohol prep pads. These are batteries to change out the inside of this. Regular AA batteries. Always bring batteries and a flashlight. I forgot a flashlight. I know I have a couple flashlights around here somewhere, so I just need to find them before I go. Disposable stethoscopes, always need to bring those. So I brought these curtain things. These are actually going to go over this to divide the rooms if we need to, or create a patient room if we need to. So that's what these curtains are for. Last year we were using sheets that we bought, but they were pretty see-through, especially with the bright sunlight, and so it kind of got awkward when you get naked and it's like, yeah, people can't really see you, but they can see you, you know what I mean? Nah, we're not doing that. We have some gloves. Always bring gloves. I have a bunch of gloves in here. Most of the suitcase is gloves because we go through those so quickly. These are some dental like papers, but I also bought a bunch of extra of these like in white for us in medical. I also got some little toys. So kids, you know, when they usually, at least in my office, usually when kids come to the doctor's office, we give them little toys or stickers to go home with. It's very small. They cost almost like 10-20 cents to the dollar for each one, and it's something just to like, you know, get them kind of motivated and break down the wall that they have up about, oh, I'm gonna get shots, oh, this is gonna hurt, oh, it's a new strange person that I don't know. So usually it helps if we are able to kind of like give them something. And then I bought a bunch of these like packs. So there's 4 that comes in a pack. I got them on Amazon. These packs are big and square, and they tend to, in my opinion, they're gonna help for us to pack like a blood pressure cuff, a glucometer, a pulse oximeter, all in one, and then we'll be able to very easily take all of that out the next day, pack all of our other diabetes testing supplies and everything that we need in there, and gauzes, like alcohol prep pads, everything, and we won't have to worry about needing to try to restock as soon as we get back to the next mission the very next day. Like I was saying before, having stuff for the kiddos. So I got a bunch of stickers. They had them on sale at Walmart for like $1.10 or something. So I got Lilo and Stitch, Bluey, I think that is. I got a bunch of different stuff. Elsa, so there's a bunch of stuff here. I think that's most everything I got. Oh yeah, and then these. So you always need these ear tube things. So I got a bunch of those. And then these, we always need these. These are the things we suction out. You know, you use it to suction bulb trachs, or sometimes it's the noses of people or children. So I bought these, and those will be helpful as well. Thermometers, right? We can gift these to patients, like parents who, we can gift these to parents who have little kids. Skin markers I also got skin markers, little skin markers. We use these to mark the skin on patients who we think have like an infection or a rash that's spreading, and we want to just kind of keep track of the area. Or sometimes we use it to mark an area if we're going to do a procedure. So a bunch of different things. So it helps to have those. That, I think, is everything I got. It feels like nothing talking about it here on the video, but it's actually a whole suitcase full of material. So I'm gonna try to pack all this back up and go take a shower, take a quick nap, wake up in the morning, work out, and then get going, because I actually have a brief stint in Canada that I have to do before I head to Jamaica. So I hope this video was helpful. It's gonna be pretty much just me showing you all of the footage of what I got. But yeah, if you guys have any comments down below or anything else that you would suggest that I should bring on a mission trip, or that you've brought on mission trips that you've gone to, please comment down below. I'd love to hear. I'm still learning. I've only done a few of these mission trips over the last few years, so I would just love to hear what everyone else is doing. Bye.
But look at you. Look how far you've come. You faced your trauma.